It seems that everyone, including you, or at least someone you know, is complaining of stomach pains. And if they went to clinic or hospital, they were diagnosed with stomach ulcer and are given medications to heal it. However, the ulcers seems to return after a while, despite the promises of the doctor that as long as they take these antibiotics, they will not have those attacks again. Hey fellow seekers, welcome back to the channel. If you are new here, my name is Jacob. I'm a holistic practitioner in all the 14 dimensions of health and wellness. Today, we're going to talk about stomach ulcers. Stomach ulcers, or medically known as peptic ulcer disease, is a condition in which there is a break in the inner lining of the stomach, the first part of the small intestine, or sometimes the lower esophagus. An ulcer in the stomach is called a gastric ulcer, while the one in the first part of the intestines is called a duodenal ulcer. The most common presentation of duodenal ulcer are waking at night with upper abdominal pain, which improves with eating. With the gastric ulcer, the pain might worsen with eating. The pain is often described as a burning or dull ache. Other symptoms include belching, vomiting, weight loss, or appetite. About a third of older people have no symptoms. Complications might include bleeding, perforation, which is creating a hole in the wall of the stomach, blockage of the stomach, and worst of all, even cancer. Bleeding occurs in as many as 15% of cases. The prevalence is higher in third world countries, where it's estimated at 70% of the population, whereas developed countries show a maximum of 40% ratio. Ulcer was a condition which existed since ancient times. The main culprits who were accused were stress, spices, stomach acid, and even witchcraft, with multitude of treatments including antacids and even surgeries. It was only when two Australian doctors, Barry Marshall and Robin Warren, proved that it was rather caused by a bacteria known as Helicobacter pylori, named that because of its helix or spiral shape, which is found in the stomach of 50% of the world population currently. After receiving resistance from the medical community, Dr. Marshall took an extreme measure where he swallowed the H. pylori bacteria to prove it. Few days later, he developed nausea and vomiting, and after endoscopy, which is inserting a long tube camera in the mouth to look at the gastrointestinal system, it was proven that he had inflammation of the stomach, gastritis due to the bacteria. He took antibiotics for a few days, which led to a total healing from the infection. They were both awarded a Nobel Prize for their momentums and life-saving discovery, while antibiotics alongside proton pump inhibitors, which stop acid production, were mandated as the official treatment for peptic ulcer disease. H. pylori secretes urease enzyme to create an alkaline environment which is suitable for its survival. It expresses blood group binder. That is why people with blood group O are susceptible to ulcers, including me, which enables it to attach to the gastric epithelium or the wall. The bacterium also expresses virulence factors which cause stomach mucosal inflammation. Mucosa is the inner lining of the stomach. This reduction in acid production causes gastric ulcers. On the other hand, increased acid production at the pyloric antrum, which is the end of the stomach, is associated with duodenal ulcers in 10 to 15% of H. pylori infection cases. Taking non-steroidal anti-inflammatory drugs, NSAIDs such as aspirin, can increase the risk for peptic ulcer disease by 4 times compared to non-users. The risk for getting a peptic ulcer is 2 times for aspirin users. Risk for bleeding increases if NSAIDs are combined with other drugs like steroids, which are given for conditions like asthma, and anticoagulants, which are given for bleeding. Stress due to serious health problems such as those requiring treatment in intensive care unit is well described as a cause for peptic ulcers, which are also known as stress ulcers. Even though modern science has correctly identified the cause and assigned a proper treatment, then why is peptic ulcer disease is having a resurgence? There could be a couple of reasons that you should avoid. Of a prescription of painkillers, especially NSAIDs like aspirin, increased transmission of H. pylori due to street food, kissing, sharing food or not washing hands, stress epidemic due to overworking and lack of proper sleep, acidic diet including processed food, fast food, sugar and soda, habitual alcohol and smoking, which both lead to gastritis, the inflammation of the stomach, which after a long time can be predisposed to ulcer, obesity, which leads to abnormality in the stomach, hence creating weak stomach, eating irregularly leading to acid release on empty stomach, especially missing breakfast, not eating diet full of fiber, which reduces food time in the stomach, hence reducing the secretion of the acid, not drinking enough water, which dilutes the acid, and lastly, antibiotic resistance due to overusing it, hence reducing the effectiveness of the treatment. So if you have one problem currently with your health, work, education, finances, relationships, parenthood, or life in general, if yes, please feel free to talk to us in an effort to find a solution based on our expertise and experience in counseling and coaching together. Book a free 30-minute consultation by clicking on the link below.